We're going to talk about culturally sensitive healthcare and the importance of culturally sensitive healthcare within the hospital settings or healthcare settings. We know that the National Health Service is built on principles of equality, compassion, and respect for the delivery and the diversity. As one of the largest and most cultural and multicultural system in the world, NHS serves the people from wide range of religious and cultural backgrounds. And among these communities are Hindus represented as a vibrant, growing population across the United Kingdom. A good proportion of the people who work in the NHS are from Hindu culture. There are 1.2 Hindu people within in the United Kingdom who are users of the NHS or National Health Care System. Ensuring that healthcare services are culturally competent and culturally sensitive to Hindu beliefs and traditions and the Hindu practices, it is important to step in delivering truly patient-centered services which are appropriate for patients from all faiths and communities. Hindu philosophy emphasizes the balance between the body, mind, and spirit. And health is seen as the absence of disease, but actually it is not just the absence of disease. It's a harmonious state of physical well-being, mental stability, and emotional balance combined with the spiritual awareness. Many Hindu patients therefore view healthcare through the holistic view and holistic lens. Alongside the modern medical treatment, they may value practices such as yoga, meditation, prayer, and dietary discipline. Understanding these perspectives can help the healthcare professionals communicate more effectively with Hindu patients and support their recovery in the culturally respectful way. One clear idea, which is a practical value, is the cultural awareness that make a significant difference in the diet. A large proportion of the Hindu follow the Hindu vegetarian diet, and some follow the strict dietary restriction based on religious principles such as ahimsa or non-violence. Ensuring that availability of a clearly labeled vegetarian meal in the hospital is available and necessary and is operationally implemented in order to have the important aspect for providing the respectful, culturally sensitive care. When patients are confident that their dietary beliefs are respected, they trust in the healthcare providers, and this trust increases as more satisfaction happen in the culturally sensitive care, and this improve the treatment adherence and improve the patient satisfaction. Another important dimension in the spiritual support during the illness is that many Hindu patients and their families offer prayers, chanting, and spiritual reflection in order to comfort during the difficult times. And having access to these services and the Hindu chaplaincy services or spiritual advisors is invaluable. Chaplains help patients cope with the anxiety, grief, and uncertainty, particularly during the serious illness and end-of-life care. Their presence can often support the families and the patients which follow the traditional practices such as prayers, sacred readings, and rituals for the comfort. Healthcare environments that recognize the culture and the spiritual diversity contribute to better patient experience and better patient outcome. Simple steps such as respecting prayer needs, understanding fasting periods during the religious observations such as Navratra, and allowing space for family involvement can create a more supportive atmosphere for patients from the Hindu backgrounds. The Hindu NHS network aims to support the NHS in achieving these goals by raising the awareness of the cultural needs, promoting the dialogue between the healthcare professionals and communities, and encouraging the participation from both staff and the patients. The National Health Network seeks to strengthen the inclusivity within the NHS. I can say that ultimately the culturally sensitive healthcare beliefs benefits everyone. When patients feel respected and understood and supported, then their healing improves and become faster and more effective. By embracing the cultural awareness and collaboration, the NHS can continue to unfold the mission of delivering the compassionate care for all communities across the whole United Kingdom.